and she is traveling abroad. We may be also joined by Deputy Minister or maybe some of the officials. You have had all the various leaders within the different branches of health and the NICD acknowledged already. So we want to acknowledge all who are here with us this morning. We thought it's a very important briefing to make, seeing that there's been quite a lot reported about the novel coronavirus. And so as the Department of Health, we just wish to assure the public that South Africa is adequately prepared for active surveillance, early detection, isolation, and case management, contact tracing, and prevention of onward spread of coronavirus infection. And to share full data with the World Health Organization, South Africa has no reported or suspected cases up to date. We do have the apology of the the director for WHO, who is not able to join us personally, but may also be sending some representatives. Research into the epidemiology or a natural history of the virus is ongoing. Although the origin of the disease in Wuhan City, China, is suspected to be zoonotic, that is animal origin, evidence suggests that the current spread is from human to human. According to the WHO, the incubation period is about 2 to 10 days, though some literature has cited up to 14 days. More evidence is needed to determine if asymptomatic patients are contagious, although the preliminary evidence suggests that, like SARS and Ebola, all the contacts reported were patients who had symptoms. Typically, patients present with flu-like symptoms and cough. The disease can be complicated by shortness of breath, multi-organ failure, and death. Most fatalities reported were elderly persons or persons with pre-existing comorbidities, suggesting that these are population groups that are most at risk. Contrary to some of the media reports, there is no evidence that the genotype of the organism is mutating. So the virus still looks the same now as it was first isolated in December last year. The department is aware of the cases that have emerged in countries outside of China and is closely tracking the movement of the virus. The numbers change rapidly, so I may quote something now and only to find that by the time I get to the end of my address, the number has changed so drastically, so I won't even give you any numbers as we speak. But I think all of us are aware of the numbers that keep getting reported, mainly from China. Closer to our shores, we're aware that there's a suspected case under investigation in Zambia. The NICD is closely monitoring that situation. We will shortly invite Professor Cheryl Cohen from this institute to elaborate in more detail how the institute is tracking the numbers and how it keeps the public and stakeholders informed. You will also have the opportunity to walk through the Emergency Operating Center straight after this briefing, where you will be able to see for yourselves the hard work and the expertise that goes into responding to a disease outbreak that could be potentially pandemic. On the 27th of January, we published travel advice based on WHO recommendations. These take into consideration all factors which determine the level of threat to a particular territory. I may as well pause here to say that we are also on the lookout with detecting some fake news that seem to be distributed in social media as notices coming from the Minister of Health which is untrue. And so we will be doing our own briefings regularly so that you know the authenticity of the information that you're getting. The guidelines have not recommended any restrictions on travel and trade, but it is recommended that non-essential travel to Wuhan city in Hubei province should be avoided or postponed. Prospective travelers can monitor the situation and plan their travel accordingly. Our understanding is that currently Wuhan city is essentially quarantined and 5 million citizens have been evacuated. Chinese authorities have closed all public transport entering and leaving Wuhan and other areas in Hubei province. South Africa has responded rapidly to ensure that the coronavirus does not become a national threat. As a department, it is standard procedure to monitor emergent outbreaks, and we are currently tracking a plethora of pathogens, including those viruses of pandemic potential like H5N1. We also then wish to reassure that coronavirus is no exception. We're working very carefully to ensure that we track everything around this virus. In the recent past, we've effectively responded to public issues such as the Ebola virus outbreak that is currently ongoing in the Democratic Republic of Congo. And even in this case, we would actually have details of a case detected in Congo even before it lands anywhere close to us here. And for us as well, we have been able to pick up any suspicious cases and screen them and test them and make sure that it is not Ebola, so that there is not a risk that a patient could be wandering around without us being aware of what risk might have been. So we are very, very tight in that kind of management. In regard to the coronavirus, due to the rapidly evolving situation in China, the multi-sectoral national outbreak response team, this is inside this country, was convened on the 24th of January 2020. We call it MINORT. It comprises WHO, national departments such as Home Affairs, Agriculture, International Relations, Tourism, representative of the private health sector, and so those departments that tend to be immediately affected by the nature of the virus that will be detected tend to be the ones that meet, and so we've convened this team regularly. At that particular meeting, the incident management system was set up with the key roles and responsibilities identified and named responsible official attached to each key functional area. So already that team is in place. The current activities already undertaken by the Department of Health and NICD include an alert that was developed and disseminated to all provinces and stakeholders. MINORT and provincial outbreak response teams have also been activated, so our provinces are now on full alert on this matter. Press releases have been circulated and various officials from Department of Health and International Relations have been interacting with the media and the public. Our media analytics have revealed that 284 media citations of coronavirus with estimated reach of over 125 million people between 20th and 26th of January 2020. We're trying to maximize our reach to the public. A hotline has been set up at NICD to field questions from clinicians. South Africa has also developed and distributed clinical guidelines and case definitions to doctors and nurses in both the public and private sectors, which include information on how to diagnose and respond to a possible 2019 NCOV case. Provinces have activated outbreak response teams and are on high alert to detect and manage inadvertent cases that may arrive in the country. Screening of returning travelers from China at major airports have been intensified. I'll also go into a little bit of details in this regard, as this is, of course, an area of paramount concern. Our port health officials routinely conduct temperature screening for all international travelers. Those of you who have been traveling abroad could have noticed that we have thermal screening, which is conducted at a distance, and that everyone actually coming through from international travel gets subjected to this routinely as they land at the OR Tambo and the other airports. However, due to the current risk of importation of inadvertent cases of the coronavirus from Wuhan City, our port health authorities have intensified surveillance of all travelers from Asia, especially in China. We should welcome Dr. Chirombo from WHO, as we indicated that they'll be joining us as well this morning. Port Health Services is responsible for preventing, protecting, providing a public health response to the international spread of the disease through the point of entry. Port Health Services are also are provided in 36 points of entry with a staff complement of about 300 personnel. The service is provided on an ad hoc basis in the remaining smaller points of entry, and those are points of entry where people just local nearby entry points where one or two police would be there. There's very little movement of people. It's mostly villagers, and those are the ones we're talking about. But where there's proper high volumes, we're actually on the lookout on all of those. Screening is conducted in the port of entry to early detect an ill traveler by the following means. Temperature screening is conducted in 12 points of entry utilizing non-invasive thermometers, where all travelers arriving through these point of entries are channeled to the temperature screening. So this number is going to be increased in the next day or two so that it covers most of the other areas that I referred to. If a traveler is found to have an elevated temperature, they are assessed by a nurse, and if determined to be a suspect case, they are transported to the health facility for further management. The NICD is immediately notified. Arriving conveyancers, that is transport vehicles, health officials go on board each arriving international aircraft and ship to determine if there is any sick traveler. If traveler falls ill whilst on board, port health officials are informed by the crew members in line with the World Health Organization and International Civil Aviation Organization's requirements, and an assessment of the traveler is conducted upon arrival. If the traveler is found to exhibit symptoms consistent with the novel coronavirus, the traveler will be transported to a medical facility for further management. When contact information of travelers who may have been in contact with the ill travelers are collected and used to follow up if necessary. So if there are symptoms, we can deal with the patient and bring them in. And that's why we make the point that we have not got any research to suggest that an asymptomatic patient who's got no fever can in fact can be contagious. And that's the basis on which that whole system has been structured. As the busiest port in Africa, special measures have been introduced at OR Tambo, airport, where travelers on the direct aircraft from China in the past 14 days are required to complete a questionnaire for possible contact tracing. The National Institute of Communicable Diseases remains vigilant in monitoring the movement of this virus as reported by World Health Organization, and the team will take you through, as I said, through the Emergency Operations Center to show you how they do this. And I think it's important for the media to have a sense of all the steps that get taken there, so that when we talk about it, we have a sense that there's actually a very deep level of expertise and competence that sits behind the technology that detects the movement of the virus. An emergency committee meeting was convened on Wednesday. Firstly, we are working closely with the international community and particularly with the Chinese officials through the WHO. So there's ongoing continuous contact with the Chinese officials. An emergency committee meeting was convened on Wednesday, 22nd January 2020 by the WHO Director General under International Health Regulations, IHR 2005. They concluded that although the development in China were concerning, it's still too early to declare public health emergency of international concern. There is a wide consensus internationally that there is no cause for panic, with experts pointing out that the common flu still remains an important disease burden. So just as a matter of comparison, the WHO still estimates that seasonal influenza, as the usual flu, may result in 290,000 to 650,000 deaths each year due to respiratory disease alone. This perspective is important to maintain, lest we get distracted and lose sight of the ongoing priorities. So some of the stuff that we used to, we kind of take for granted, in fact, is still a lot more problematic than the virus that has just erupted. Just because of the panic, I think it's important to always keep the sense of proportions in sight. We've received a number of queries regarding the safety and health security of our citizens living in China, particularly those in Wuhan City and Hubei province. A meeting was convened by the Chinese Foreign Ministry with diplomatic mission on 27 January 2020. In summary, the government of the People of Republic of China has assured us and reassured us that there is no evidence to support the necessity to evacuate foreign nationals living in Wuhan City, and they have called for calm in this respect. All persons entering or leaving Wuhan are subjected to a 14-day quarantine to ensure that they do not develop symptoms. Foreign nationals who need medical assistance for whatever reason will be treated like Chinese citizens and be afforded all the medical care that is necessary in that area. Embassies are also enabled to support those locked out and locked inside Wuhan. And in our discussion with the Minister of International Cooperation, Dr. Naledi Pandor, she indicated that DIRCO is aware of at least 35 South Africans in Wuhan City, and they are in touch with the citizens who are there as well as the authorities, and therefore if there's any need to respond or to do anything, they will be in a position to judge that. At the moment, they believe that we just need to monitor that situation. I've asked the Ministry of International Relations to be here with us, but of course, as I've indicated, because of her travel, she's not around. But if there would be the other officials, they'll be able to share if there's anything new to be able to share at that level. DIRCO has been closely collaborating with all relevant stakeholders to respond appropriately to the needs of our citizens who either may want to go or exit or remain in China. It's important to understand that how we respond as a country must represent the best interest of the people who we intend to assist. In conclusion, I wish to then reiterate the basic principles to reduce the general risk of transmission of acute respiratory infections, which include avoiding close contact with those people who are suffering from acute respiratory infections, frequently hand washing, especially after direct contact with ill people or their environment. But frequent hand washing really is a basic precaution that all of us should be always familiar with. Avoiding unprotected contact with farm or wild animals if traveling in China. And when sneezing or coughing, it's better to cover your nose and mouth with a tissue or arm, not your bare hands, but more kind of like that. In case of symptoms suggestive of respiratory illnesses, before, during, or after travel, the traveler must seek medical attention and share the travel history with their health care provider. So this, for us, constitutes the briefing for today. We will therefore be giving you regular updates, literally on a daily basis. We'll be issuing voice notes through radio stations to keep the public informed, but we'll also just make sure that you've got the right people who will be able to respond to your questions, who you can invite as media to do interviews, elaborate interviews, to discuss the subject in your studios, and so on, so that on a regular basis we prefer that you get people who are our experts on this subject. Sometimes, to get the story out there, we sometimes may invite people who might create the sensation, and the public may not be able to detect the level of involvement of those individuals in the process of our surveillance and monitoring of the evolving outbreak out there. So we prefer that we have available to you those who are actual experts on the matter, so that they give us up-to-date information that is really linked with the operations of detection. That way, I think we'll be able to deal with this matter. We've seen that in the media, for one case that gets reported in one country, a whole sense gets to develop that, maybe there's a lot of patients already teeming inside our borders who are affected by this virus. And we just want to assure South Africa that we are on very high alert, and we, in the way that we are dealing with the virus and the way we're monitoring the situation, it wouldn't be possible that someone could just slip under our fingers and then land up in South Africa and cause a kind of damage that we have been completely unaware of. That's why we made, again, I reiterate the point that the current clinical manifestation of the virus is such that for the virus to be contagious, it has to be coming from people who are exhibiting symptoms, amongst which symptoms is the issue of fever, and that's the easiest to detect, and as I've indicated, and with the alert on which we have South Africa, we will be able to pick up the virus or an infected patient at any one time. We are also open to to answering questions. As I was saying earlier, the Minister of Home Affairs was indicating, someone was asking him, he was discussing something unrelated, but they say, what about coronavirus? We should be on alert, but we shouldn't create an unnecessary panic. I also think we can't, let our guards down. We therefore need to always keep our information balanced and factual, so that we can make sure that South Africans are properly informed about what situation we are in. At this point, therefore, let me hold it that and allow us to take the next briefing, and then we will be open for question after that. Thank you very much.
Thank you very much, Minister. We'll ask Professor Cohen to please proceed with the